Hey guys, and welcome to today's live stream. We're going to be talking all about heat and ice when it comes to back pain. Which one should you be using and why? We're going to go through our experience and what we recommend in the clinic. So hopefully you guys are going to find this super helpful in clearing up some of the confusion around this topic. If you're new to the live stream, please do consider subscribing to our channel. We can normally speak effectively, and we do these live streams every single weekday. We do the Q&A at the end, so you are welcome to get your questions in the comment section as you're watching this video, whether live or after the fact, and we will do our best to answer those in the Q&A section towards the end of today's video. With that being said, let's get into heat and ice for back pain. All right, guys, so we're going to be talking about this topic today. It is one that is very confusing for many people because you hear so many different viewpoints, and a lot of that when it comes to things like heating and icing for injuries in general. The reason for this confusion is that there is tons and tons of research on it, some saying heat's good for this long or that long, some saying ice is better for this time or that time, etc., etc. And a lot of it is done on sports injuries in particular because it's so frequently needed and required. And really today's live stream is more about our experience and what we find works best with patients and why when it comes to back pain. Now, this is not the same as if we've sprained an ankle, etc., in terms of the approach, because there's slight nuance differences which I'll get to a little bit later. But we're going to talk about what we're trying to do with the icing or heat and when is best to apply it. So first and foremost, as I mentioned, there is lots of different research on the pros and cons, and a short PubMed or Google Scholar search will come up with tons and tons of information, which is why it's so confusing. There's different timings for these, there's different protocols for these. Some people are saying using ice for so long, 20 minutes, half an hour. Others are saying heat for shorter or longer periods, etc., etc. So it's no wonder that it is very confusing. But if we hone in today on the live stream and talk a little bit more about back pain specifically, what should you be doing? And when I talk about back pain, that means sciatica, it means slip discs, it means bulging discs, it means if you've got degenerative disc disease or if you've got some level of spondylosis in that lower back, what should we really be doing in those scenarios? And all too often we're finding that the recommendation for people that are maybe in the Back in Shape group, or maybe you're new to our channel and you've just got back pain, you've seen other people in the past, they normally recommend heat. Say pop some heat on it, it'll feel lovely, get that hot water bottle on there, and that'll really help. And the thing is, the heat feels nice. People will say a warm shower feels nice, and it does. But the question really is, does sitting there with a hot water bottle on your back feel nice anyway? And is it just the fact that the hot water feels nice and soothing, period, and having the heated seats in the car when you don't have back pain feels nice anyway? Is it just that general pleasant feeling of warmth that is happening, or is it actually helping the problem? And we'd really argue that actually it's not helping the problem at all. It's just that it feels nice, and we'll get into a little bit more of that later on. First, if we talk about what is actually happening in the body when we have an injury. Well, when we injure, say for example the ankle, we'll take that and compare that to the lower back. When we have an injury, we get the release of certain chemicals in that area which cause the body to shunt fluid, shunt nutrients, shunt circulation, vasodilate, and drive resources to that area. And that, as most people have sprained an ankle or at some point in their life, or know someone who has, the ankle can balloon up in quite a way. And the purpose of that is in that 48 to 72 hours, we want to get resources there. We want to help create a plaque so we can release growth factor, etc., etc. And if you want to read a little bit more about that or learn a little bit more about that, last Monday we did a live stream on collagen and tendons on Tuesday as well, where we covered a bit more about that reactionary sort of process. And in the ankle, it's okay because there's nothing particularly important around there. It's close to the surface of the skin, so there's room for elasticity, and the swelling isn't going to create too much of an issue. But when it comes to the lower back, we have a very finite space. We've got that small hole where the nerve is coming out, and if we have too much fluid in one area, then potentially that's going to lead to a lot of compression and buildup of pressure inside that finite space, which is that spinal canal or the exit foramina where those nerves come out, which is where they normally get caught by those discs, and we end up with that trapped nerve type symptoms or sciatica in the leg. So when we're using heat, what are we doing? Well, when we pop heat on an area, we're driving more fluid to the area. We're driving more fluid circulation through that area. When we're popping ice on the area, we're getting a retreat of fluid from that area. And if we've got that constant signaling chemically, biochemically, from the injured tissue in our lower back to the rest of our structure to drive resources, and that's there 24/7 or consistently over an extended period of time, do we really want to add to that by providing more heat and more stimulation to drive more fluid to that area? Because quite often people say, well, we've got that strain in the back, we want to put some heat on there to get more nutrients into that area or to relax the muscles. But if we're going on a muscle diagnosis, then that's all too often so far from the truth. The muscles are not the problem in the lower back, they are the reaction. And that's commonly why heat is often used. But if our body's already signaling that we want more circulation in that area, and we don't want to get it out of control like it can in the ankle, we want to control that reaction a little bit more, then the use of ice there can help temper that reaction from the body so that it doesn't get out of control, because we can't afford too much inflammation to build up. And quite often it is actually more the inflammation buildup in that finite canal that actually catches people out. It's the process. As soon as we straighten back up, we close those little holes, and because there's inflammation there, it increases the pressure in that hole and gives them the pain. And that's not that it's making the problem worse, as opposed to forward bending, which is creating more strain on the injured tissues. As we straighten back up, it's the presence of that excess inflammation that's actually irritating those nerves, and that's why that's painful. So getting a handle on the levels of inflammation in that area by using the ice and calming it down a little bit so it doesn't get too out of control is going to be a much more sensible approach than using the heat. That is very, very important. Excess inflammation is not good, especially in those confined spaces. So please remember that when we're considering what should we be using. We don't want to help that process, and it's not needed, because you've got the chemical inducement, the body's own inducement of driving more circulation to that area. So why would we recommend using using ice? Using ice is there to help calm down that inflammation so we don't have too much. But at the same time, we do want new nutrients to come through. So when we pop that ice on the back over that area of the lower lumbar spine, maybe 4-5, maybe L5-S1, it's going to create a vasoconstriction. It's going to reduce the amount of fluid that's coming into that area, and therefore it gives it gives that area time to breathe, time to relax a little bit. And then when we take the ice off, blood is going to naturally then flow and flush back through. And I use the simple example here for patients to help them understand, is like putting Mr. Muscle down your sink. It goes down and it just clears everything out. It works quite nicely. Using that way of completely restricting off the blood circulation and then allowing it to freely flow back through, it just helps get things moving in our experience with patients and helps them manage the excess consistent wave of inflammation and vasodilation that's going to that area. And by using heat, we just shunt more resources to that area, and it tends to get a little bit stagnated, a little bit uncomfortable, and ultimately make things worse after we've used the heat, rather than actually calming the inflammation down, which is the goal. Now, how long do we normally recommend? We normally recommend people using ice for around about 3 to 5 minutes on that lower back. And if you're using a thick towel, maybe not necessarily the best idea. Using a small tea towel can be the most useful, because the ice is going to get through there relatively quickly. So you've got in a 5-minute application of ice over the center of the spine at the lower lumbar spine, you're going to get around about 4.5 minutes of icing. If you're using a very thick towel and it takes 5 minutes for the ice to actually start feeling cold on your back, then we might want to do 10 minutes there, because 5 minutes you're not actually icing, it's just going through the cloth. So do bear that in mind. But around about 3 to 5 minutes of icing on the lower back, done repeatedly, works an awful lot better. And if you're in the Back in Shape group, then you'll know all too well about the use of ice in conjunction with the other exercises in phase 1 and so on and so forth. So we won't get into that too much here, but there'll be a link somewhere underneath this video where you can read a little bit more about the Back in Shape. But using the ice in that manner is much more helpful. The one concern we do have if we use ice for too long, and sometimes people overdo it, they're doing it for 20 minutes, half an hour, is that we can negatively impact the lymphatics. So the way in which the circulatory system works is we have the blood vessels, so the arteries, and then drained by the veins, come into an area. They go into the capillaries here, and then they come out. So these are the capillaries here, and what's essentially happening is fluid and nutrients are pushed out of here into the surrounding tissues, and then we have the lymphatics that get all this fluid and drain that. But those lymphatics are not under pressure, they're not necessarily as pumped as the cardiovascular system, as the arteries and as the veins. And sometimes using a bit too much ice can be like freezing the pipes. If you turn your boiler off during the winter and the pipes freeze over, then you turn the boiler on afterwards, you know that's not a good idea. We can damage the boiler, damage the system. It doesn't work as well because the pipes can often freeze over. So if we're using ice too aggressively, we find that that also doesn't work very well for patients. Doing that 5 minutes works an awful lot better, and repeat applications works. Now, there is one scenario, and I'm going to go through this particular scenario and then we can get into Q&A. So if you've got any questions, then please do post those now. There's one scenario where we do recommend heating, and it can work. And really, I suppose it's something that we haven't discussed much before, maybe occasionally in the Back in Shape with one or two people under choice circumstances, but the use of contrast bathing. And this is whereby we might do 2 to 3 minutes of heat and then 3 to 5 minutes of ice, and alternate those. We might do that 2 or 3 times through. So heating for 2 to 3 minutes, then ice for 3 to 5, then immediately heat, and then ice, and then immediately heat, and then ice, and then we're finished. Always, always, always finishing on ice for obvious reasons. But that can work as an even more aggressive way of just getting rid of, flushing through some of this excess waste products that are in that area. Excess metabolites that build up and affect negatively the functioning of the tissues in that surrounding region. When we've got an injured structure, we've got a lot of tissues that maybe they're not getting the appropriate circulation that they need, so they build up a lot of lactic acid. The excess presence of that starts to interfere with normal cellular function. And if you've ever done sort of some very high-end cardio or physical exercises, you know those muscles start to twitch and fasciculate and move in a way that's not very good when they've just flooded with lactate and lactic acid. So by being a little bit more aggressive with the icing and heating, we can really flush through that area and get rid of some of those waste products in a more aggressive way, which works quite nicely if we want to reduce the inflammation more quickly. One of the main reasons we don't get into this too much on a daily basis with regards to our recommendations is because it is quite a faff to do. It's very difficult to have the hot water bottle on the one hand and the ice in the other, and we've got to keep the hot water bottle hot and we've got to keep the ice cold. So it can be one for you to sort of pull out of the bank if you're really struggling. Maybe you've done something a little bit wrong, or maybe you've got a very, very chronic issue and we want to start getting some circulation back through that stagnant area of our lower back. The use of contrast bathing, hot, cold, hot, cold, hot, finishing on cold, can be a tool that can be used from time to time, but I generally don't think that is necessary in the vast majority of cases. It's just a little bit overkill and a bit more inconvenient than anything else, so that's why we stay clear of it. But it is the one scenario where we would say using heat would be a helpful adjunct to the ice therapy to just manipulate the circulation, and that's all we're really doing here. That's why we recommend the ice. We're manipulating the circulation in that lower back to the injured structure. And one final thing before we get onto the Q&A is, where are we putting that ice? All too often people will put it over the buttocks, they put it on the back of the leg, they put it on the lower leg where the symptoms are. We have to diagnose our back pain properly, and we have to figure out where the cause of that is. And although some of you may actually have MRIs and you know that the disc injury is at L5S1, but you have no pain in the back, it's only in the leg, we must use it where the injury is, because if we're putting it on where the leg pain is, we're not really going to be doing anything productive whatsoever. We want to really put that ice or that contrast bathing right over the center of the spine, at the base of the spine. And you can find that area by finding those two bony prominences at the base of your spine and come in where the dimples are, come into the middle, and then come up about a thumb's length or about an inch, and there is the L5S1 junction. The other way to find it is come onto your waist here, come straight in round at the back, and you'll find the spine, which will be about L4. So above and below there is where we want to put that ice when we're doing these routines. So that's pretty much it. We'll go over to Q&A, Lara.
Okay, awesome. Good morning, everybody. Please do continue popping your questions in to the comments section. I do think that there is some things that you can buy that you like click and it turns cold, and then you click the other side and it can turn hot. Maybe that's something that we can look into for everybody. If
I think the one thing with those is on the research side of things, cold is different to ice. So it can be cold, but ice is going to be a little bit more noticeable in terms of the effects, especially if we're trying to get a local vasoconstriction, i.e. just reduce that inflammation very, very quickly and then allow it to flush back through. The use of ice or very cold can be, it might need to be ice rather than cold. Interestingly enough, a couple of years ago we used a CO2 jet, which was really, really nice. It was actually a cold spray. It sprays you at, I think it was minus 140 or something degrees, and you just spray that over the area. Actually, it doesn't feel bad at all. It feels quite nice, right on that area to rapidly decrease the temperature there, and then you remove it. Obviously, you stop the therapy. It takes about 2 or 3 minutes max. It might have been less than that, actually, if I can't remember 100%. And then the circulation returns back to that area. So it's a much more advanced, a much more aggressive version still of reducing inflammation or just manipulating the circulation to an area, which is very interesting.
Wow, was that effective?
It was really good. It combined with, we were looking at something that was going to work synergistically in the approach, and it kind of seemed to try and do the same sort of thing as the laser. And the laser, I think, is better functionally and easier to do and more pleasant, and just it makes more sense. The laser's using a photochemical reaction whereby light hits certain molecules and things happen, whereas with the cold, we're just decreasing the temperature, and the change in temperature allows circulation to happen, but it doesn't change much else.
Okay.
And also, technically speaking, if you're using really cold temperatures, that's going to slow down metabolism, and that may be good for inflammation reduction, but it's not good for healing.
Okay. And the laser does feel really nice.
Yeah.
Okay, awesome. Some good questions coming through here. So Sally said, morning, if you have a back injury, would you not recommend a sauna, even if finished with a cool shower?
So this is the one thing. There are numerous benefits with using a sauna in particular. You've got infrared saunas and there's other types of saunas, and there are tons of benefits. Immune system in particular, thinking of current circumstances and the last couple of months and probably the next year. So there are numerous immune and general health and well-being benefits of things like a sauna, and providing you can get in there, if you've got one in your house, that's awesome. But yes, I would just say as soon as you get out, cold shower or ice straight on that lower back, because that would be acceptable. That would be under the category of sort of that contrast bathing. As long as you finish with ice on the area that we don't want getting out of control, then there's no issue with that whatsoever.
Okay, and Jeannie's asked, what about hot tubs? Would that be very similar to a hot tub?
The hot, so yeah, you've got the same sort of thing. That there's not the same benefits of hot tub. Hot tubs are nice because it feels nice with the jets on your back, which is fine. There's no issue with that. But I would say again with the hot tub, maybe don't go in there for so long, especially when your back is not doing so well. But please, if you're going to do these therapies, climbing into your own hot tub, I think, is likely to be very minimal in terms of any risks to your well-being. It's not the same as going swimming in the pool. Some kid could run past and knock you over or something like that. Things happen on the pool. As someone who spent a lot of time in pools when I was younger, I know that accidents can happen, and last thing you want is if you've got a back pain for that to happen. But if you've got your own hot tub, jumping in there but making sure that you use the ice afterwards, and maybe not indulging in the hot tub for quite so long as you ordinarily would be an okay thing as well. It's not quite as good as the sauna from the additional health benefits, but that's good.
Maybe not quite jumping in there if you've got
don't jump by jump I mean slowly lower yourself into the hot tub using the stairs and the supports, rather than bombing in and upsetting whoever else is in there.
Okay, Karen has asked here, any benefits to cryotherapy treatment in a
Cryotherapy
clinic for back pain?
I don't know. I know there was a place in Harvey Nichols that was doing the whole body cryotherapy. So basically, imagine a sunbed but really, really, really cold, a stand-up one. It's kind of like that. I don't know necessarily how beneficial they are, but it runs along the same sort of premise as sauna therapy. Essentially, what you're doing here is you are stressing the body out with either very, very hot or very, very cold. And the response to that is upregulation of certain immune systems, certain functions in our body to make us more resilient. And you're using it in controlled dosages. So not so much for a lower back issue, I don't believe, because I just don't think it's going to be helpful enough. I think it would be, you'd only have to do that on its own. I don't know how much benefit it's going to have to the lower back, but I think that along with the sauna, they do have some health benefits. Which you need to look into in more detail.
Quite a bit more for like stress and anxiety and immunity.
Yeah, because basically
it's like the Wim Hof breathing.
It's essentially like the Wim Hof breathing. Essentially, and he obviously does a lot of the cold stuff. Yeah. You're using stress, physiological stress, to create such a reaction in your body that it kind of tries to reset itself or something along those lines. You're going to get a reaction in your body to that level of stress to try and get you basically stronger. It is basically the premise. Okay. It's the same way it's the same thing that you're doing when you're using weight. If you're going in the gym, you're using stress to overstress your body so that it adapts and changes and becomes more resilient.
Okay, brilliant. Sally's asked here, a bit off topic, intense ache in the glute when doing a lunge. Techniques checked, lunge not very low. Can you help me understand what is happening? Thanks, Sally.
You know, the lunges, people don't realize how challenging they actually are. I know one of the guys was also doing them more recently and was like, whoa, I didn't realize one of the guys in the premium membership didn't realize how much didn't understand why the lunges are so much more difficult than the squats. But the activation that's taking place in the glutes, so the big glute max, but also deep in there, in sort of in the buttocks, in those lateral hip rotators. So that's going to be piriformis, it's going to be the gemellus, it's going to be the obturator muscles, and that's one of the reasons why I'm not a big fan of piriformis as a main problem, because it's one of 6 lateral hip rotators that are working all together at the same time. But it's probably those smaller lateral hip rotators that are actually working overtime to stabilize your body weight, and it's just a little bit much work for them. So it's a case of finding a nice middle ground between what's enough to stimulate those guys and allowing them the time to adapt and recover, not necessarily doing any massage in there and poking them too hard if they are being challenged a little bit more than necessary. When we're doing those glute stretches afterwards as well, be a little bit more gentle on that particular side. Don't yank it quite so hard. And what you should find is that the overworking, the tension, the aching, the pump that can build up in that region will start to subside as those muscles get stronger for the same number of reps. And sometimes it's actually worthwhile. Maybe you're up to, I don't know where you're at, Sally, at the moment, but maybe you're doing 3 sets of 10. And maybe in a couple of weeks you're doing 4 or 5 sets of 10, actually going back and doing 3 sets of 10 and seeing how that affects that same sensation, because the sensation may stay the same as you go up through 3, 5 and so on sets of 10. But if you go back to doing 3 sets of 10, you might go, oh, wait a second, that's really not that difficult. I don't get as much of the pain there because you've got stronger. You're constantly working on the boundary of what your body's able to do and pushing that boundary so that you keep the pain, or the pain remains there for a little while. But when you then go back to something you used to do, you can do it more or less effortlessly. And I experienced something similar to this with the running that I've been doing, jumping on treadmill the other week on 10 kilometers an hour, which was something that I started on a little while ago, earlier this year. And it was easy, effortless to do that. Whereas before it was very, very tiring, very, very difficult. But all my running is very, very tiring, very, very difficult, because I'm always working at the limit of what we're able to do at that given time. So it's very, very draining, very difficult on the system. And when we actually take a day to just go back at a lower intensity, we realise actually we're capable of a lot more than we used to be, with a lot less discomfort.
Okay, awesome. Hope that helps you, Sally. Do let us know if you've got any other questions.
Yeah.
Kate has said here, after you recommending that regime, it did help a bit more with my neck, especially after the jolting from the choking episode. How often can I do this? Still probs with the towel under the neck. But this regime does seem to calm it down.
So what
Kate's
referring to the heat and ice. So with Kate, I said use the contrast bathing that I mentioned earlier at the end of my bit on this video.
I wasn't sure if it was like the neck exercises.
Well, in conjunction with those, okay. but it was using that heat and icing to just rapidly try and just get that inflammation to calm down, or the excess inflammation to calm down and just normalize, so that there's a little bit of inflammation there because we've got to do healing, but not excessive amounts, and I think that's made things easier. It might be worth you periodically doing that every couple of days. How inconvenient is it? You might find that actually doing that and then waiting for 5-10 minutes for your body to warm back up again, and then doing the towel exercises might be the best time for you to be able to do those most effectively. A careful note that waiting for after you finish that last episode of icing, waiting for a couple of minutes for your body to return to normal temperature, and then doing the exercises, not doing them immediately afterwards. That might be worth looking into as another test, because sometimes just really aggressively reducing things allows the inflammation to get out of the way, so you can do the right exercises to help your healing. So that can be something worth a little test, Kate. But I wouldn't necessarily say it's something that you need to have as part of your daily practice for the long term. Like I mentioned earlier, it's better to have it in the bank, and when things are a little bit difficult, you can pull it out and use it, because it does become a little bit time consuming, and obviously using it if there's a little bit of a flare up along the way, or if you do find the method I just mentioned with regards to doing it just before your exercises is helpful, then it might be something you use when you're about to go up to a new plateau.
Okay, brilliant.
I wouldn't say it's necessary to do every day. the same way we would normally recommend the icing.
Okay, awesome. I think that is everything for today. Awesome. Thank you everybody for your questions.
Awesome. Thank you very much, guys, for joining us, and thanks so much for the questions as well. Hopefully those answers were helpful for you guys, and if you do have any further questions, please do post them in the comments, because we do still get those alerts on here, and we'll do our best to answer those questions as best we can, and maybe even address them on the next live stream. So if you are finding these live streams useful, please do consider sharing them or hitting the subscribe button, and make sure you hit that bell so you get notified when we go live. We do these live streams every single weekday, and every single weekday we do the Q&A. It's our way to help you guys, give you a little bit of advice, a little bit of guidance, so you can make sure you navigate the process of getting your back in shape or your neck more effectively, and steer clear of some of those risk factors and some of those common pitfalls. So thanks for joining us, guys. Have a great afternoon, and we will see you all tomorrow with another live stream. Thanks for joining. Thanks so much for joining us on today's video. Hopefully you found it packed full of useful information. If you want to learn more about the premium Back in Shape membership, there's going to be a video somewhere underneath here. And if you want to stay up to date or tune in to some of our more recent live streams and the Q&As at the end of those, then that's going to be down here. And remember, you can subscribe to the channel up here and hit the notification bell to make sure you know when we next go live, so you can join us for our next live stream and Q&A.